I was interested in bioregulatory therapies for 5 or 6 years, and I studied the science and the technology and what was available on the market, but I never found the devices satisfactory. When I met Dr. Lednicki and I learned about his approach to BRT, I found it to be a truly holistic approach and one that could work very well in my practice. The way I explain BRT is in two ways. The first is to consider the general model that I use, which is called endobiogeny, which is a holistic approach to looking at how hormones manage the body. So I explain to my patients that if the hormones are managing your body and making it more democratic, BRT is working at the level of cells, which are like the population. So BRT makes your cells want to be ruled by the endocrine system or the hormones. I'm seeing a number of benefits for my patients using the BRT devices. The first is at the level of body-mind interaction and helping to address some of the emotional and mental barriers to healing. So when patients come and say, I've tried everything, nothing works, or I have the opposite effect every time I take something, the BRT tends to help break that cycle of therapy resistance. I also use the BRT devices to make people more receptive to the treatments that I use with natural plant products. So once the electromagnetic communication networks are restored at the cellular and subcellular levels, people respond faster and more efficiently to the plant-based treatments that I normally use with them. I have the full office suite of the Cellcom and the Sano Center, and I generally use those in combination in the office. In the lobby, I have a Meridian fractal unit, which I encourage the spouse or parent of the person being treated with the Cellcom and Sano Center to sit down and use, because I find when you treat a patient within the ecology of the entire family, everyone gets better. I have a very robust rental program as well, in which I use a number of the home devices as well as the mobile devices. What I like about using the home devices with the office devices is that they complement each other. The more severe or difficult or challenging a patient's problem is, the more likely I am to start them off exclusively with office-based treatments with the Cellcom and Sano Center, typically for about 6 to 12 treatments. And then for the convenience of the patient and their family, I recommend a home therapy unit to complement what we've already accomplished and extend the healing benefits. And then I generally recommend that they come in once or twice a month if they live close enough to continue to get the unique benefits of the Cellcom biofeedback device that cannot be accomplished at home.